Hello everyone, I'm Vikas. I'm the founder of a startup company AlgoSurg and team lead of OpenSurgiSim project. My team also includes my co-founder Amit Maurya and clinical experts like Dr. Manish Agrawal and Dr. Mangal Parihar, who are very senior orthopedic surgeons of the country and expert trainers in the field of deformity correction. Together, we have developed many innovative technologies, especially in the field of complex bone deformity corrections. It is estimated that more than 30% of total number of bone deformity correction surgeries need to undergo revision. This is due to the lack of expert surgeons. In fact, the number of expert surgeons that exist today is just 10% of what it is required. There are just not enough trainers. And that's why we created OpenSurgiSim. It's a cloud-based software to train any junior or trainee orthopedic surgeon to gain expertise in bone deformity correction surgeries. OpenSurgiSim is easily available on internet, free of cost, and it can be accessed anytime, anywhere, even in the remote areas. It acts as a personal trainer for a trainee. It trains the surgeon not only to plan complex bone deformities, but also to acquire necessary psychomotor skills. And it automatically assesses the training performance, thanks to the cutting-edge technologies like object tracking, 3D rendering, 3D graphics, 3D printing, and augmented reality. So let's see how OpenSurgiSim works.
OpenSurgiSim can be accessed through Appropedia. A trainee will first learn the basic principles of deformity corrections through reading material available at Appropedia. This material is very easy to understand with rich schematics and annotated videos. The trainee can then access OpenSurgiSim at www.opensurgisim.com. The trainee first uses the planning module of the software to learn planning of deformity correction surgeries on digital X-ray images, which are available in the software as various case studies. These are real-life patient cases carefully selected by an expert surgeon. The trainee will learn to plan a surgery case by following the step-by-step guidance from a previously created surgery plan by an expert surgeon. There will also be non-guided training cases, where the trainee does the entire planning but without the benefit of the guidance. At every critical step in the planning, the software questions the trainee to assess the performance for that particular step, and finally makes up overall score for each planned case. The final and the most important part of the training is to apply the planning onto a physical bone model, that is the psychomotor training. For this, the trainee uses a web camera, few clamps and fixtures to assemble a training setup as per the instructions. Trainee will also have basic tools for drilling and cutting the bone models as well as an external fixator implant. The bone models will be assembled using the parts from a modular bone kit. The parts of the kit can be assembled to form various types of deformed bones for different case studies. The trainee then follows the instructions given by the software to perform various steps of the surgery, like assessing the extent of deformity, drilling and placing the fixator pins onto the bone in a pre-planned location and angle, cutting the bone, and finally achieving the correction by assembling the fixator frame to the pins. The webcam of the training setup captures the training process and the software tracks the bones and tools. This object tracking is used to overlay information on the computer screen to guide the surgeon to follow pre-planned steps and give them real-time performance feedback. The object tracking is also used to measure the errors in various steps like drilling, cutting, and final corrections to calculate the final score for each case. The psychomotor training is also performed in guided as well as non-guided manner with many repetitions for practice. To help the trainee to methodologically improve the training pathway, the overall assessment scores are presented in various forms. The score for each case study, the overall score, the gradual change in the score, a comparison to an expert score, and a category-wise score. Apart from the basic theory material, the Appropedia will also have information on how to access and use the OpenSurgiSim software, how to use the surgery planning module, how to obtain and assemble the various tools to be used in the psychomotor training setup, how to use the psychomotor training module of the software, and finally, how to analyze the overall assessment.
We believe that OpenSurgiSim will help many trainee surgeons to gain expertise in complex bone deformity corrections without a need of any expert trainer and even at low resource settings. Thank you very much.